And otherwise we'll get going with things. So it's my pleasure to introduce you to Sarah Pritchard, who is an occupational therapist as part of our mobility clinic here in Kitchener-Waterloo. Sarah did not provide me with a bio today, so I get to say whatever I want to about Sarah. So, which is like super um, daring on her part because I mean anything could come up here. So, anyway, Sarah's been with Mobility Clinic, I think, since around 2011 or 2012. I could be wrong on that date. It's been a long time. Occupational therapy, if anybody knows occupational therapists, who probably most of you do within, this sort of speaking and what we're talking about, then you know just how valuable it is to have an occupational therapist. And Sarah's been like tremendously valuable to our team in terms of not just the OT roles that she does, which are vast and incredible, and we've learned so much from her during the time, but also she's a clinic manager. So the administrative side of things and just how she thinks has been incredibly valuable to our mobility clinic team. So um, that's mainly what I'd say about Sarah. If you don't know an OT, get to know an OT. They're fabulous people. Sarah graduated some time ago from Queen's University. I don't know the year. So she is official. And aside from that, I welcome Sarah and her great presentation today.
Thanks, Jamie. That was better than I thought you'd do. All right, I'm going to share my slide. I think I know most of the people that are here, so welcome. Okay, Katie, bear with me while I figure out. There we go. All right. So, uh, thank you for coming and listening to my little talk. Um, yeah, so thanks everybody for joining. Great into communities and families. Um, so over the 1920s and 30s, there began to be education programs for occupational therapists, and in about 1926, it was kind of established as a regulated health profession or a health profession here in Canada. Currently in Canada, there's about 22,000 OTs that are registered. About 50% of those, or 55%, work in direct patient care. Others work in various other roles throughout the healthcare system. If you're in Ontario or Quebec, we have the largest OT workforce. But Manitoba and Nova Scotia have the highest number of OTs per capita. There's your little lesson for the day. Um, Oftentimes people ask what occupational therapists do. I'm not going to answer that question today. In terms of what we do, though, um, with individual patients, it always starts with a comprehensive assessment. So, however you come to an occupational therapist, whether it's somebody with a spinal cord injury, in a mental health setting, inpatient, outpatient, school-based, comprehensive assessment is always our starting point. And then from there, we would move to develop kind of client-centered interventions. So the goals we work on are really what matter to the individual, which is oftentimes the goals that are also what is a priority of the healthcare system, but sometimes they are not. Um, the main focus of most of those goals is to promote participation in whatever that occupation or activity is that somebody is striving to do. Most of the time, our solutions are practical solutions um, that involve kind of real life scenarios and resources. Um, we often address a wide range of issues. We work with people across various populations, ages, um, and the overall kind of goal would be to focus on function. OTs have historically been known for their role in rehabilitation, but since about the early 2000s, there's been more of a move towards interdisciplinary care, specifically in primary care, which has been a great opportunity for occupational therapists to share kind of our knowledge and our profession with a different setting. So in Ontario here, there are multiple family health teams and community health centers now that have very established OT positions. As Jamie said, I have been in my role for, I think it's about 14 years. And I have colleagues in other family health teams in our area who have also been in their roles kind of since the beginning. And I think that really speaks to just how valuable the population that we serve in and the environment that we work in is. When I first started at the family health team, there was lots of conversations about, oh, what's OT? How does it work in primary care? And reflecting on that a little bit, I think I've come to understand that there's a lot of shared values between kind of your traditional primary care environment and what occupational therapists do. First of all, is the person-centeredness. When patients walk in to see their family doctor, they might have a priority condition that they're addressing, but they're often seen as a person first, and they often know that person and things that they've experienced in their life leading up to that intervention. And I think that is really unique to primary care. It really leads to kind of that continuity. The other thing is the collaboration that happens in primary care, really linking patients and families with the supports that they need, the accessibility and inclusiveness of it, as well as kind of just that focus on the person as a whole, how they're functioning, how they're living their lives. So I think that there's a really great fit. I don't think I know. There's a really great fit between OT and primary care in kind of our approaches. Um, in theory, it sounds like it works, and I think the mobility clinic is such a great example of how it works in practice. That we've really strived to take a model that has interprofessionals working together to meet the needs of a certain population. So in our case, people with mobility issues. Um, it's great opportunity for patients to get a, a comprehensive kind of healthcare experience, but also for us as professionals to learn from each other and work together. I think it really does help us all become better providers, but also helps to reduce some of those barriers to access, whether they're physical or systemic. One of the kind of takeaways that I always kind of am thinking about is even though we have a population such as spinal cord injury, um, the diversity within that population is vast. And I think understanding that is the key to providing kind of the truly comprehensive care that patients deserve. So, just in spinal cord injury alone, the etiology of their injury can vary quite a bit, their level of injury, how complex it is, whether they're stable or maybe their condition might progress or change over time, whether they're ambulatory or non-ambulatory, new injuries or illnesses, or many, many years living with a condition. I think the other thing to take into account is all this is already on top of the context of cultural diversity, social and economic determinants of health as well. So it's really uh, an individualized approach every time. And I think that's why primary care is important. Being that first point of contact that somebody might reach out to when they have a new concern, somewhere that they can get some help with coordinating the supports that they need, whether they're healthcare or social. Um, I think the focus on preventative care is fairly unique to primary care and occupational therapy as well. That proactive approach versus a reactive approach also becomes really important for any condition, but managing specifically the secondary complications that might come after a spinal cord injury. It's really important to be able to have those conversations early on and help prevent complications from coming up, but also to make sure that people know what to do if something comes up. And then also the support for mental health, social participation. So OT can really act as a bridge between that medical management and day-to-day life. And again, I think the one takeaway that I always take is that, it's not a one point in time intervention or involvement. That's one of the real benefits I could say of my role is that consistency with knowing somebody throughout a course of their experiences. So that is true of, I think, a few other professions, but it really does help to understand the experiences that people go through. Um, just as an example for spinal cord injury, if we look at some of the transitions, these are just a few of many, many examples, but early after a spinal cord injury, there's a transition home from hospital or rehab. There might be an adjustment period for people as well as their family. They might be recovering from a traumatic event. Um, a point in their life, they might think about returning to work. They might actually retire from employment. They might have a family, get married, have children, get divorced. They might experience some secondary conditions later in life. Their experiences will be compounded by aging. They may have caregiver changes or caregiver needs. So there's a lot of uh, potential through the years to need an occupational therapist and really work together to come up with ways of making it through all those transitions. As a way to kind of summarize some of the areas of involvement that an OT might work in, I've kind of included a few in this presentation, and with each one, I'll kind of review a little bit of a scenario just to give an example of what that looks like in practice. So, probably the most central area would be function. Occupational therapists see function in maybe a different way than other professions, but to us, function means being able to do the things you want to do. Oftentimes, that's basic activities of daily living. Your bathing, toileting, um, getting dressed, doing your groceries. We look at strengthening, transfers, posture, ambulation, whether that's walking, using like propulsion, using a manual wheelchair or power device. We talk about assistive devices and adaptive techniques, technology, home modifications, accessibility, and then also rec and leisure, things like driving and transportation. So I'll give you a little case scenario. Jordan. Jordan was a 75-year-old, several years post T10 surgery or injury, and he experienced new weakness after being quite ill with COVID. This resulted in a lot of falls, difficulty with transfers, specifically to bed and to the toilet. So when I met Jordan, we worked on strengthening. We reviewed kind of the transfer technique, made a few changes to the setup of his environment. We talked about energy conservation. That was becoming a big part of the issue with fatigue and transfers. We got some new assistive devices and we got some technology and ways of like a falls alert pendant so he could get help if needed. And ultimately, he was able to return to his independent transfers and he had a reduction in the number of his falls. Another area of OT intervention would be uh, something like participation. So, how does somebody manage to engage in meaningful activities? That might be resuming previous roles or activities or exploring new opportunities to participate, return to work, return to school. Travel would be another one in this category. So for this example, Alex was a 35-year-old parent living with a C6 spinal cord injury. He used a power wheelchair and wanted to become more involved in coaching his children's basketball team. It was something that he had never done. It was quite important to them. So in this, we focused on not just Alex, but his community and his family. First barrier was some accessibility issues and some transportation issues. We explored the various roles that could be involved with being a coach. We had to use some adaptive equipment and some kind of low-tech strategies to figure out how he might be able to um, contribute as a coach with his whiteboard and his whistle. And we educated the league and the parents and the players. Ultimately, Alex was able to co-coach with another parent. He took on all what he called the bench duties and coordination tasks, increased engagement with his children, his community. It provided a significant improvement to mental health. Also encouraged other parents who may have been more reluctant to be involved to also come out and contribute. Another area that is important for spinal cord injury as well as OT would be prevention. So teaching things like self-management techniques, also self-advocacy techniques, how to screen for a secondary complication, how to communicate with another healthcare provider. What do you want to ask for when you go into this appointment? So we support a lot in terms of skin management and pressure injury prevention, advising someone of early preventative strategies, so that if they do have any concerns, they're caught early and hopefully resolved quickly. We focus on things like energy conservation, ergonomics, that type of stuff, as well as lifestyle things, or cognitive and mental health resilience. Um, this case scenario is Maria, 46-year-old with a T4 spinal cord injury, and she uses a manual wheelchair. She received a promotion at work, which significantly increased her desk-based work hours. And she reported some increasing shoulder pain and some redness on her right hip. So the OT involvement with her involved a lot of education, skid maintenance and pressure injury prevention, ergonomics, joint prevent or protection strategies, as well as some environmental modifications and assistive devices that helped her kind of extend her workday. So ultimately, she was able to implement those daily pressure checks. We adjusted her workstation, and she had reduced shoulder pain. Her skin health was improved, and she was able to maintain her position and her work hours. Um, Education is another kind of key area where OTs are involved. This can be teaching clients about their condition and functional changes. It can be providing strategies for daily life, training them on assistive devices and technologies, also educating families, caregivers, other community supports, um, and also sharing kind of knowledge and best practice. Um, For this next scenario, a local foot care clinic reached out for some advice. They indicated that they wanted to better serve patients with mobility challenges, but were unsure where to start. So this was more of a consultation approach to speak about accessibility, an office setup, education about, various conditions that they might have, how they could set up their clinic for kind of a practical flow, and what some low cost modifications might be. Ultimately, the clinic was able to implement some small changes. Probably the most valuable was staff education, where they were able to inform everybody from the person who answered the phone to the person who was providing the service about how they could make little adjustments to support somebody who they might see presenting with a mobility difference. They cleared some pathways. They figured out a way to support patients who couldn't transfer. They changed the length of their appointment times, and ultimately have been able to support more patients. The last area that I'll talk about, but probably one of the biggest at times, is the area of system navigation and advocacy. Everybody who's been through the healthcare system or works in the healthcare system knows that it is extremely complex and ever changing, and knowing what to do and when to do it is sometimes the hardest part. So, oftentimes, especially in my role in primary care, there's a lot of assisting people to access programs, supports that they need. So that's things like funding for wheelchairs through assistive devices. It could be community programs. It could be Ontario Health at Home for some services. It's making sure they're aware of things that could benefit them. Specifically, transportation services are a big one. Recently, in the last few months, things like disability tax credits, so they can get federal benefits, have all kind of been um, important. Makes a big difference to patients to not just know that these things exist, but know that somebody will help them figure out how to get them. Coordinating with other care providers. So oftentimes people will have caregivers, or maybe they're supported by other agencies like independent living. Um, so coordination between agencies, supporting transition, whether it's, someone I've worked with who's gone into hospital or somebody who's new coming out of hospital. That collaboration before the transition is so beneficial. Um, we also collaborate with other multidisciplinary care teams within kind of our own area. Also community partners, advocate for clients' rights and systemic change, and most of all, empower clients to self-advocate for themselves. And the last scenario is John. John was a fellow who underwent an emergency spinal decompression and fusion of the cervical spine, and he was discharged home with no formal rehab or supports. He lived alone. He was experiencing a number of falls, and he really couldn't manage his basic activities of daily living. He's on ODSP for a pre-existing mental health condition and has a history of substance use. So John's intervention was strongly around system navigation and advocacy, connecting him with Ontario Health at Home, funding applications, updating his ODSP information so that he could access things like transportation and supplies, um, helping with getting out in the community, volunteer driving programs. Um, and then ultimately, John was able to receive some support with his ADLs and IDLs. He got the equipment that he needed, and he was managing safely and independently with his daily activities and was able to remain living alone in his home as he wished. So that's kind of the conclusion of my little chat here. I think that my reflections or takeaway points is just to focus on how OTs can play a really important role in long-term outcomes for people with chronic conditions and evolving needs. There's limited evidence specifically to OT, but what does exist suggests that in primary care, OT services are being used in chronic disease management, self-management, education, falls prevention, and community service collaboration. There's one study from 2023 I've listed down there. That was kind of a scoping review. Um, Even with that, I would think there's also barriers that remain. Some of them are knowledge, like knowing what the benefits are, others funding, equitable access to service, and kind of the ever-changing climate of healthcare. Lastly, I'll just open up for any discussions or questions.
Yeah, thanks, Sarah, so much for that great overview. It's always amazing just the sheer scope and breadth of what occupational therapists do. And I love the cases. We will open it up to any questions or discussions. And then Katie, do you also have a QR code that you can, I know you posted in the chat there, I think. Do we have one on a slide or anything as well that we can?
Yeah, I'll share my screen here.
Yeah, so
And Katie, do you need people to raise hand or anything like that for?
Yeah, I think people are able to just unmute themselves as well. We're a pretty small group today, so that should be fine.
Yeah. Yep. So we'll open it up if there's any questions.
Well, hey, Sarah, Craig here. So you're mid-career now as an occupational therapist, and so I'm just curious. Since you started in practice till now, what are some of the major, most dramatic changes you've seen in how you practice between when you first started and now? Like, be it with assisted devices or policy or programs, or what's the biggest changes that you've seen?
it's a good question, Craig. You and Jamie both pointing out my age today. I don't know.
You're mid-career. I'm late career. You're mid-career.
Mid-career. Um, I think some of the I mean, technology is certainly a big change. I think that that is always one that I would say. I think the challenge with technology is that the systems don't always keep up with the technology. So there's amazing technology out there, especially when it comes to like wheelchairs and home systems for, voice activated controls and things like that. The challenge, I think I would say, is that those don't often get funded, so there's limitations. Um, yeah, did I answer your question? Yeah.
Hi, Sarah, it's Steve.
Hey, Steve.
I recently have acquired a position here where I live, well, will be maybe, and I'm going to need access to a mechanical room, maybe using a stair lift or something like that. Is that something that you would come in to assess, or is that something that that I just go to a company like, and is something like that funded? Could I get
Mm, that's a good
government
question.
funding or something like that?
Uh, that's a good question. I'm a likely no if it's not within your home, but in kind of the building. We can definitely chat about it. You know how to
Okay.
reach me. Um,
Yeah.
yeah,
Like it's something that I'm gonna have to talk to the board about funding too. So
yeah,
I just want to get all my ducks in a row before I
ducks in a
approach
row.
that. Yeah.
Yeah,
But just make an appointment with you.
yeah. And I think
Okay.
that's a good point. The answer is always, yeah, let's talk about it. Sometimes there's not, and sometimes there's something I can do to help. So,
Okay.
yeah,
Thank you.
no problem.
I think Steve having the expertise of Sarah is definitely like important for that, right? Um, and that's, what we've noticed over the years is that, we don't, many of us don't have the expertise in these things, right? So in adaptation to environments and what people need and that kind of stuff has been, really invaluable. So yeah, I think that's a good example there of something that's actually probably not something you see every day either, right, Sarah? Most of the sterilist would be in the home and that kind of stuff. So it's a
Yeah.
really interesting scenario. I will ask a question, Sarah.
Uh-oh.
Um, so OTs, and this is really similar to primary care physicians and everything in that as well, right? Like you guys have a really, as we mentioned, really wide breadth of things that you do and that type of thing. And I guess maybe one of the challenges for the spinal cord injured group of patients might be finding OTs that are, and you touched on a little bit in your presentation, but finding OTs that are knowledgeable in their condition, ranging from understanding the condition, um, specific things that might need to be done. I really think a lot of like seating and that sort of thing, which I think can be a big barrier in many communities. I know you do seating, but not all OTs do seating and that kind of stuff, which is understandable. And everybody kind of has their niche of practices and everything. But, just kind of going on the barriers that you talked about in the last couple of slides, like in that spinal cord injured population, what are the main barriers out there? Um, how do people potentially overcome those, realizing that we're often speaking to a Canada-wide population? And what do you see as kind of maybe the way forward? So it's a pretty broad kind of, you know, tough. But yeah, I just think, spinal cord injury, like everything, exposes the gaps that we have in care. And I don't think that's different in OT. So what do you sort of think about
Yeah.
that?
Um, yeah, I mean, that's certainly true. It's been as true as long as I've been in practice. So I think that it'll probably be true for a while longer. I think probably one of the most important things is to know where to look. So oftentimes, especially for our clients, they're really uh, they're really directed to one place to look. And if that doesn't pan out, they don't know where to look further. So I think even in the last little while, even now, I would say it's probably not typical for people to come into an office and say, "Oh, I need an occupational therapy therapist," and for anybody to think of anywhere where to send them other than, "Oh, I'm going to send you to Ontario Health at Home," or whatever that track is. But I think that there is still a lack of knowledge about how to access the services. So if we're talking about seating specifically, yes, Ontario Health at Home is kind of the go-to, but there are also private options. There are also seating clinics in tertiary areas that people may prefer to go to or may want to go to because of the specialist approach. So I think that knowing where to look, knowledge, not just knowledge about like where to look, but like why that's so important. I think that's one piece that's missing. Um, I think that the other reason of how we can address that is obviously a more complicated question. I think we need more supports, more funding. We need to look at those things like what are the health outcomes of not having a good wheelchair? Like I don't think that's something that's highly researched or um, looked at from a money perspective. Even though when you work in the industry or you see the patients that we see, like we know the value. I know the value. Um, and the other thing is sometimes people just get comfortable with there not being an option. That's one of the big things is like learning how to self-advocate. I think there's tends to be people at both ends of the spectrum, ones that just don't have the abilities or know how to do that. And then we have the opposite end, which are people who can really excellently advocate for themselves. But calling and saying, I need something and being told, oh, we don't do that, like you kind of have to keep doing it, keep calling, keep asking, which is often exhausting, but the reality of the system. And then I think just trusting in other healthcare providers, even though, there's lots of people who may not have expertise in your condition. OTs specifically, like we see so many diverse people, we may not have an expertise in your exact condition, but we can like learn enough to support you. We often have our own networks where we might go for support or help. And then that might build capacity within the system so that instead of just passing along people saying, well, we don't have that expertise, we could be like, oh, I did that once, it actually worked out well, and kind of you can build your knowledge that way. So it's kind of my initial thoughts.
Thanks.
I have a question for you, Sarah.
Hi, Julie.
Hi. Um, so related to like spinal cord injuries, OT, I feel like, people are very aware of kind of they need help with getting equipment, learning transfers, strengthening, all of that kind of stuff. Um, Two areas that I've noticed between the hospital and community that maybe don't get addressed as much, or uh, people with the spinal cord injury don't maybe feel comfortable bringing up as much, is around like sexual health and the mental aspect of going through a spinal cord injury and the grief and the transition and all of that afterwards. Do you find that your patients are bringing those things up to you, and that they're getting addressed, or do you still feel like that's kind of an area that's, maybe not being as addressed as much, just in general, by not just by OT, I just mean in general of everyone? Yeah, just curious what your thoughts are on those two areas.
Yeah. I think, your experience and my experience would be the same, and that those are definitely two areas where patients might be less likely to seek out help, and us as providers might be less likely to bring them up. I think, we've had lots of conversations as a team of how we can help facilitate that. I think one thing I have noticed is that, um, you know, being able to have that conversation with somebody who you're familiar with, or you know, or you trust and have a relationship developed with sometimes helps the situation. So oftentimes we will, maybe not discuss things with somebody a first, second, third, fifth time we see them, but eventually there is a comfort level that develops and they might be more open to discussing those things. But yeah, generally, those would be two areas that um, I think both clients and providers have to really work hard at um, addressing.
Hi, Sarah. Christiana, can I ask you a question?
Yeah.
It's something that you said just when James was asking you that question. You talked about how wheelchair, and that there's not a lot of evidence and literature out there on, I think, the benefits of it. And funny enough, we have been working with Peter A. and Chris Cowley from University of Manitoba, trying to do an economic analysis of um, of recent wheelchairs, more specifically one that is prescribed and personalized to the person versus just any type of wheelchair. How much more benefit it will have for the individual. And you're right, we did a lot of literature search as well as interview some manufacturers, and we couldn't really get enough evidence to move forward with an economic analysis.
Yeah.
Just because there are so many different types of benefits to that individual when they have a properly fitted wheelchair, but it's hard to capture that better benefit.
Yeah.
So, do you have any advice, or how do you see, what will you hope to see if kind of to move that forward, if to document the benefits of wheelchair?
Yeah. That's such a good question. I wish I knew too. I think that yeah, I don't know. Like I love to hear that it's something that um is being
Yeah.
talked about and thought about. I do think that I'm not surprised by what you said, that there's this kind of that lack of evidence or ability to capture it, because I think it's something that maybe even unique to things like spinal cord injury, maybe a little bit with some other conditions, but like oftentimes there's just that a lack of knowledge even by the person who's using the device, right? So people who have maybe gone through rehab or had a lot of conversations or involved in, a bigger wheelchair community can really see those benefits. But I mean, I continually educate patients about what the value is, right? Because oftentimes they're like, well, I have a chair. It was from my grandma, but it's fine. Like there's a lot of still that lack of understanding about what the difference is between wheelchair from your grandma, which could still be valuable for some things. But yeah, the benefit of something that might be more personalized.
Yeah, it sounds like it's not, they don't know until they try it.
Yeah, seeing is believing type of.
Yeah.
Yeah.
Thank you.
So, yeah.
Okay. Well, thanks so much, everybody, for joining. Thank you, Sarah, for, a wonderful presentation and, really highlighting the super important work that you do. We would ask everybody to please consider filling out the survey that Katie has just posted there. Again, we thank you for your time, and we will be hosting another webinar in the near future. So just keep an eye out for that. We'll send it through the regular channels. Yeah, thanks once again, and everybody have a great day.
Thank you.
Thanks, everyone.